Hi everybody, thank you for joining the live. I'm just waiting for iheed Health Education Dermot Bretnach to join. Just 2 seconds. So I've just invited. I hope everyone is well and having a good day. It's a bit, in Stoke-on-Trent is quite rainy outside. Just waiting now for iheed to join us. There we go. Let's see. I'll invite them again. So we're going to be talking about the Paediatric Diploma, the professional Paediatric Diploma that iheed provide. I completed it in January, so I'll be talking about how that went. I'll just see, apparently they can't join the live. I'll just re-invite again. So yeah, hopefully it'll be really useful for those who are considering a diploma in paediatrics. Hello.
Hello, how are you, Dr. Zainab?
Oh, I'm good, thank you, Dermot. Lovely to see you.
Yeah, you too. Apologies, I'm a minute late. I was having fun with my Bluetooth trying to get it connected.
Oh, it's absolutely fine, absolutely fine. I'm so glad that we could do this because I've been talking about the Paediatric Diploma since I've done it, trying to encourage others to do it. So this will be a really good way of getting people more information as well.
No, and likewise, I think there's a world of information about the program out there, but there is absolutely no substitute from hearing from somebody who's done it, who's completed it, who's successfully completed it. It's the warts and all experience, and what you liked, what you didn't like is really, really important.
Yeah, absolutely. First off, I would like to say, just to anyone who doesn't know me, my name's Zainab. I'm a GP in Stoke-on-Trent in the UK. So that means family doctor. And yeah, so I did this as part of my training, wanted to improve my knowledge, but I'll talk about that in a second. I'll just hand over to Dermot. Just explain, Dermot, who you are as part of iheed. And
yeah, delighted to. So my name's Dermot Bretnach. I lead the academic function at iheed. We're an online medical education organization. We were founded by a family doctor really to try to expand the availability of qualifications to people all around the world. And we've a suite of about 12 programs now in areas like pediatrics, dermatology, obstetrics and gynecology, as well as master's programs in public health and diabetes, etc. So I work very closely with the colleagues in the Royal College of Physicians of Ireland to run the program. So effectively we designed a curriculum and we developed the most amazing online content, and then I think we've assembled a pretty stellar faculty to deliver this as well. So everything to do with kind of program delivery falls to me and my team, some of who I've seen joining, which is great.
Yeah, that's cool. So yeah, no, I mean, obviously you know so much about every single program that iheed offers, but particularly the pediatric one really stood out to me personally. But I know that you did postgraduate medical education as well, and I've had a look into that too, and then obviously the dermatology course as well. So yeah, so go for it. You're going to ask some questions.
So I was going to say, to lead on exactly from that, what drew you as a family doctor to pediatrics? Presumably you see kids every day.
Yeah. As part of my GP training, I actually did a pediatric job as well. And I've got 3 children of my own. So for me, children are quite, I know what a sick child can look like and things like that. But I saw one case stood out to me. So when I started this new job, this was sort of January last year, I saw a child who looked really, really sick. And I don't know, for some reason I just thought he didn't look right. I just referred him into the children's assessment unit, did all the observations and things. And when the discharge summary came back, it said that he had Kawasaki. Now, in my career so far, I've been a GP for 5 years, I'd never seen a Kawasaki case. And I thought, I didn't even think of that as a diagnosis. I just knew this child looked unwell.
Yeah.
And that made me think, am I just bobbing along on basic knowledge that, oh, hopefully will get me through my GP career, my family doctor career, or do I need to sort of sharpen up on my knowledge? And I was actually scrolling through Facebook when I saw the iheed program advertised, and I sent in my email. I wanted a bit more about it, and then I got a call back from when Ashlyn, who's part of the iheed team, and she basically told me everything I wanted to know with regards to how the program is run, a bit more information. And to be honest, I made my mind there and then. I was like, you know what, I'm going to do it, because it just sounds really good, and it's definitely going to, make me flourish as a doctor in family care, and especially in pediatrics as well. So
I think that story about the Kawasaki diagnosis is a very common experience, especially in general practice and primary care, where you can't be expected to have the level of depth of insight into all these conditions. But I think one of the big pillars of this program is that recognition of the critically ill child, of what are the red flags that I need to watch out for. Things like oncology are rare and for an individual doctor, you're hopefully going to see not a lot of it during your career. But what you want to make absolutely certain of is that you're not going to miss something. And I think that's, that along with child protection are probably two of the most common threads that go through all of the modules on the program. And really, I think that experience of there's something not quite right here, and being more comfortable that you'll spot that the next time and know why, I think is a key part of it. How did you find adjusting to study? I mean, one of the things that when I look at kind of the statistics of this program, obviously it's postgraduate, everyone is a doctor, most people are mid-career, you're qualified anywhere from kind of 5 to 15 years is the average. So most people on our programs are in a very similar situation to you, where they're establishing their career, they have a young family, and they're returning to study this on the side. How was that jolt back to study?
Well, I'm not going to say I was quite nervous. I thought, am I going to be able to manage this? But I did feel that having a bit of a routine, so the fact that I'd taken this commitment, I paid the deposit, I made a commitment to the program, actually did help mentally sort of think, you know what, I'm going to put my Wednesday evenings, which is when we had our weekly tutorials, aside. And I made it like a family thing. So like my daughter would sit with me, she's 5, she's very interested in seeing all these people on Teams, meeting up or Zoom, and we just used to enjoy that. And it was a timely thing, and it didn't matter whether all 3 kids were with me or not, I always had attended a tutorial. So it was difficult at times managing it, but I did make an effort to engage with the program, and I think that helped my study afterwards. So I would take aside, maybe the Friday night or the Saturday night when I knew that it was going to be quieter, and I could get a couple of hours, go through the material online, which I have to say was absolutely brilliant, and it really correlated with the tutorials as well. So, yeah.
And I think to touch on that for a second, I think that's one of the main points of an online program when it's done well, is that there's that coherence between the curriculum, the online materials, what you're studying on a day-to-day basis, and then into the assessment. And I think the predictability of knowing what it's going to be structured like, of being able to navigate through it easily, it's really, really important, because everyone on the program is a busy clinician. Most people have a family to take care of as well. So it's really important that design is there, that makes it doable, that makes it achievable for you. How did you find you were speaking there about the Wednesday evening, you were speaking about the kind of the Fridays, etc. How did you find kind of falling into a rhythm of study? Because that's when I look across, thousands of learners that have succeeded on programs, it's the planning aspect more so than the academic or the clinical aspect that helps them succeed.
Yeah. I have to say, I mean, because I made that commitment, I just made sure that, during the week I would try and cover the material. And whether it was the Friday or Saturday, it would be whenever. The good thing was that I had the mobile app as well, and so I could access it during, if I was having a break or something from work, I could just access some of the material on there. I guess once you've made that commitment, it's important to put it into your timetable and put aside some time. There were I think 1 or 2 weeks where I couldn't cover the material. Before the tutorial, when I had like other things going on with my job, and but then I quickly caught up. All the material is online, and also the tutorials are recorded. So if you're like you've run after your child who's just done some, messing around, then you can like watch that area, bit back and catch up. For me, it's the rhythm. I guess is just something that you have to build in. It's kind of, you have to do it. You can't it doesn't just happen naturally. It's got to be actively done for you. And that's what I think.
And I guess in turn, one of the things I think that people that are listening to this will be keen to kind of hear is, in terms of actual weekly load, how much effort were you putting in to succeed in the program? Because, when people think of a postgrad program, they'd be going, oh God, is this 20, 25 hours a week, or is it 4 or 5 hours a week?
No. For me, the dashboard for each week, each week module would only take, wouldn't take me that long, maybe an hour or something to go through it properly, write notes or whatever. So it didn't take that long. But I also felt the tutorials were quite good because you're learning in a different way, especially if you're engaging in the tutorials, and actually get additional information through the tutorials as well. So that meant that you were covering stuff that might not be, extra sort of clinical stuff. And that made me feel like I had more knowledge by the end of it. I just feel maybe a couple of hours, maybe extra, a couple of hours, 2 or 3 hours a week. If you could put it aside. And not much.
And I think that to me, again, from speaking to others, that would seem to be kind of the average, that your tutorial's an hour long, you'll spend an hour going through the platform on the content, and then you'll probably spend an hour or two doing other things, and in a given week those other things will change. Sometimes it'll be, I'm struggling with an area, so I'm just going to read into it more, or it's of massive interest, so I'm going to read into it more. Other times it'll be preparing for an assessment, but that, I think, again, the design of it should be that it's achievable within your clinical and your personal commitments. If that's not right, then there's something wrong with the program design. And one of the statistics we look at quite closely is the engagement level. And when we look at people on the platform and tutorial attendance and things like that, it's about 88%. Tends to be a running average. Kind of 85 to 90 is kind of the threshold it goes to. And what that says to me is, nobody's ever going to have a perfect record here. Like, everybody it's real life. Everyone's working, everyone's busy. So there will be times where the coursework will suffer. And again, the design of it needs to be that that's okay, that you've got the scope to pick it back up afterwards. No, go on, sorry.
I was going to say, I did feel that, that it didn't take that long to catch up on like the couple of weeks that I said that I wasn't able to go through the material. I did still attend the tutorials because that was something that I really committed myself to. Whether the materials, if I missed a week or, it wouldn't take me that long. And I feel you're absolutely right that the program isn't overwhelming at all. Like, it does. I did manage it very well, I felt, and also, because my job is seeing children all the time, I was constantly reflecting on what I'd learned, and then, what I was seeing in practice. It really did help build up further confidence. And I was doing extra things that I probably wouldn't have done during, before this. And
I think that's, that's a really important aspect of the program, that it tries to be very, very applied. And I guess, you could have a pediatrics program that focuses on the pathophysiology of disease, etc., rather than clinical decision making. And this program is very much hands-on clinical decision making. Yes, here's the theory and background, but actually, here's a patient case. What's the management? How do you handle this? I guess, how did you find the tutorials? Because again, I think a lot of people can envisage what what the content might look like, and it's a mixture of kind of recognizing critical illness. It's all the major systems, it's growth and development, it's got the bit of psychology, it's got the bit of surgery in it, etc. But how did you find actually I suppose the mode of delivery between the platform and tutorials and how it fit together?
Yeah, one thing I have to say, I mean, everything was so well designed. I'm not surprised, you know, I feel I actually was like in awe of it in a way, because the material wasn't too detailed. It was something for everybody. If you want to learn a bit about pathophysiology of something, it was there. If you want to learn the clinical side of things, it was there. There was something for everybody. And the way that the platform, they were all based on clinical scenarios, you know, patients coming in, and that's how I learn. I feel that really suited my learning style, because when I see a patient with something, then I don't forget, you know, oh, we did that with that person, so this worked or this didn't work. So that was really good. Also, there was a lot of, you know, questions on there, you know, like what investigations would you ask for next? And it was tick boxes and checking your answers, just testing yourself as you're going through the material. With regards to, and the summary at the end, by the way, was really good. The summaries, you know, for key points. The actual tutorials were excellent, because it kind of brought it to, it made you realize this is real. I am doing this diploma as well. You're like, you know, you are part of this community. This is someone who's taken their time out to teach you a particular part of the curriculum. And I felt almost, you know, wow, I'm having teaching every week. This is, you know, I felt really happy with that. And the tutors were very good. They, you could spin off on a tangent about a certain thing, or they'd go through the material with you. And it was a presentation, so they'd have a slideshow, and then you could discuss those things. I felt it was really engaging, for me anyways.
And how about, you know, and I think you're right. I think what the tutorials are trying to do is that mix of, let's touch on the key points of that week's topic, you know, whether it's diabetes or whether it's oncology or upper respiratory, etc. But it's, you know, what are the key points of that? And now let's discuss cases. Let's discuss where you've seen presentations, where we've seen presentations. The bit that I think is really quite exciting about this program is, you know, and obviously we designed this program not just to be an exam in pediatrics, but the education experience was as important in our consideration as anything else. And one of the things that we set out to do right at the start was have this as an international program and have it as much an international program as we could. So, you know, within each tutorial group, you'll have, if you're in a Wednesday evening tutorial, you could have Ireland, UK, up as far as kind of East Mediterranean, but then also Africa, South Africa, etc. Within your tutorial group. How did you find kind of the international mix?
Yeah, it was really, really interesting actually, because the practices of pediatric care could be different across, they were even from different specialties as well. So we had like someone who was working just in child safeguarding down in South Africa. And there was one doctor from Ireland who was an A&E doctor. So, you know, and one neonatologist as well. So there was a breadth of knowledge, a breadth of specialties, and also countries as well. So I've made, you know, we made a WhatsApp group, our group did, so that we can kind of keep in touch. And out of that WhatsApp group, I have kept in touch personally with two of them. One's in America, one's in Leeds. So I've actually feel like I've made friends. We're still in touch now, even though the course is finished. So it does make a big difference, because you feel like part of a team. But also during the tutorials, the international students would probably say, you know, oh, we do it different here, or we do it different here. But I could see that the program was quite applicable to everybody. It wasn't that, you know, it wasn't, oh, this is nice guidelines that the UK offer, or, you know, it was very much, this is standard, this is the basics of what you need to know in terms of guidelines and things.
Yeah, no, absolutely. And I've sat in when the program first launched. I sat in on the Friday 7 a.m. tutorials, which was predominantly a Middle Eastern audience, but also, ironically, that time zone particularly suited people in Sydney and Wellington. So you this brilliant mix of lots of people from around different Gulf countries, and then people in Australia and New Zealand. And again, the standards of care and resources were probably similar enough in terms of what people had available to them and what primary and secondary care did, but the way it worked was often quite different. And it was really, really interesting to hear some of those debates about how they manage situations. And, you know, particularly some of the more challenging things like, you know, some of the ethical conundrums you'll come into, and, you know, the referral pathways were all wildly different. You know, it made for a really, really interesting debate and discussion. And as you say, you know, the WhatsApp groups, I don't think were unique to your group. There's lots of that going on. And to me, that kind of community of practice and that network that you build up is it's really important. And that journey that you go on as a group is as important as kind of the clinical outcomes that you come away with, because you know it's the experience as much as anything else is what we've tried to make sure you have a really positive, engaging go through the course that leaves you hopefully with colleagues that you're going to keep in touch with afterwards. You know, that's I think that is important. How did you find the assessment?
Yeah, I was going to say, I haven't mentioned assessments yet. You know, the reason being is because when I think back at the course, I don't even think about the assessments, to be fair. You're absolutely right. The experience itself, what I gained knowledge-wise, practical knowledge, but also, you know, theoretical knowledge, was way more valuable in some ways. But then obviously you have to do assessments to pass and everything. Yeah, the assessments were I felt they were absolutely fine. The first, I know you have to do 3 video assessments, the 10-minute sort of consultations, and you can have your husband or your wife or, you know, a friend to be that role player with you, and all the information is sort of there, so the role player knows what they need to do, and you just have to do the video and send it online. It was very, and the examinations themselves, they give you a 48-hour window, where you can book the exam. So I was doing my exam about 11 o'clock in the night because I knew that my kids were going to be asleep and there was going to be no disturbance. And it's fairly simple to sort of actually do the exam. You know, the mock exam goes through the whole process. And yeah, I thought they were okay. They did reflect what I felt was part of the dashboard. If you do learn the dashboard and you attend all the tutorials and you just have interest, it really isn't. It's fine, absolutely fine.
No, and you know, the completion rate in this program is, I think it's 96%, and you, on the one hand, you go, wow, that's really high, but you expect it. Everyone in the program is a doctor. The materials are really, really strong. The faculty is amazing, and then the assessment should be fair. The assessment, as you say, it should reflect what you've done. It shouldn't be trying to throw you curveballs. And you know, for anyone that kind of attends their tutorials or watches the recordings and who engages with the content on the platform, you know, you would expect that they would get through the program no problem. It's you know, and what I find is, what I think is hugely valuable is those video assessments that you spoke about, because, and for people listening that won't have the context, the exam is standard single best answer style exam questions where you're given a clinical case vignette and, you know, you've got the detail of the presentation, and then you've got a list of 5 options. What's the most appropriate next step that you should take? That's fairly straightforward, and that really tests clinical decision making. They tend not to be knowledge questions. They're very much patient care focused. The other part of the assessment, and I think it's inspired when we look back at them, is the communication skills assessment. And when we set out to design this curriculum, we kind of put that front and center, saying, you know what, the consultation and communication skills with a child and their parent is of paramount importance. So what we ask people to do is we'll give you a case scenario, and you know, it could be to, you know, here's a presentation with a child, and you've to take a history from their parent, or you have to explain a diagnosis to a parent. And effectively, as you say, you're getting your wife or your husband or your partner or your friend to play the role of the parent. And all the information's there. It really doesn't matter if you know everything that they know. The skill is, well, actually, what's my communication style like? What's my question style like? Am I doing enough listening? And again, to me, the grade that we put on that at the end it's almost circumstantial, because to do that exercise, you have to think about the case. you've to, you know, as we're doing now, pop your phone up somewhere and actually record the consultation. And then before you submit it, you're going to watch it back. And it's that reflective piece of watching it back afterward that has the most value. It's, you know, reflection's obviously a big part of medical education, and there's very few opportunities where you actually see yourself doing a consultation and see yourself recorded on video and understand what your style is like. So I think that's a massively valuable part of the program.
Yeah. And I did feel my husband used to sort of like try and get me to laugh and stuff, like he'd say things, or like I said, I think I mentioned it before, but there was a growth, like there was one something to do with growth hormone, and he held a Barbie doll and said, "Oh, look how small my daughter is," you know, and I had to like hold a straight face. So there was a lot of acting involved, trying to like, you know, not laugh at that, but also holding Woody and, you know, the Buzz Lightyear, the brothers or whatever. So it does make it fun, you know, as well, you know. And I'm surprised that the examiners, your tutor is your examiner for the videos. So it's quite nice for them to see us doing these videos, but also seeing our partners, you know, as well.
Absolutely.
Laughing.
No, and it, you know, it is a really important part of it. And there, you know, on that one, on your the context is you're explaining the concept of a child that has to go on growth hormone injections. And one of the other videos that I've seen, you know, they get the doctor did a bunch of drawings, so that, you know, they explain through drawings, you know, what was happening, and it's brilliant for the faculty, but also for the person themselves to be able to see that and then to get the feedback on it. So, you know, the grade, yes, it's important, but I think as a learning experience, it's really, really powerful. And again, technologically, actually, that's a good thing to jump onto. I was going to say technologically easy to do. How did you find the technology part of this? Because again, for anyone watching, they might be going, "Oh, I have to record a video and upload it, and it's an online program." And, you know, people have chosen to be doctors, not computer folk. How did you find the actual technology side of it?
Absolutely easy. At the beginning, you know, right at the beginning, before we had started the course, there was an introduction webinar, and we were asked to download an app, a student Canvas app, and that had everything on there. So what all I did was I did the video on my phone as normal, and then I would go onto the Canvas app on my phone, and it would give me an option to upload the video, and that was so easily done. It was so easy, and the app itself is quite nice. You know, if wherever you are, if you're like waiting for something or whatever, you can just be looking at some of the material, and then sometimes if you want to go on your laptop, like when I was saying about the American candidate, we were really good friends. What we would do is have every week, or try to every week, have a Microsoft Teams meeting, screen share, and go through the dashboard together. Brilliant. And then that's what we were doing, like, you know, before the exam and things like that. So, you know, you can use it on a laptop or on your phone. It's so simple. You know, very, very simple.
Yeah, no, and again, that design is really important for not just kind of the accessibility piece, but the enjoyment that, you know, if it is a cold, dark February night and you're in a room studying, you kind of want the material to be interesting. You want it to be engaging and to draw you in. And I think that's you know, the really hard thing about a session like this, or any of the webinars that we give about the program. It's very hard to showcase what that looks and feels like to someone. And I think, you know, the level of thought that has gone into that content is immense, and it's updated annually to make sure that, you know, clinically it's as up to date as it can be, but also that you know, the simulations and the cases and the interactivities in it are really, really engaging. You know, the other piece then that it kind of really ultimately culminates in is, do you think it's changed your patient care? Do you think it's had an impact?
I absolutely do. I mean, although I know I did pediatrics as a job for 4 months as a GP trainee, and obviously I see patients, you know, pediatric patients all the time, it definitely has. An example I can give you is that my referrals, the way that I write my referrals, the information I put in my referrals, the relevant negatives, relevant positives. One example is about, again, with the growth hormone thing. There was a young girl came with her dad. He was worried that she had growth hormone deficiency because she was smaller than everyone else in the family, but there was history of growth hormone deficiency. And I actually noted the mid-parental height, which is something I wouldn't have done. You know, I probably would have said, oh, mum's this height, dad's this height. But I knew how to do that on the chart. I was confident with that, and I knew what that meant for the patient. So it made my referral a little bit more informative. And also, I feel more confident when I'm actually communicating with patients. One other example is that I learned from the course was that the more antibiotics we give children, the more likely they are to get UTIs. Now, that was something that I didn't know about. So whenever the children's parents are very adamant on antibiotics and they don't need them, then that's an additional piece of information I can give them and say, listen, you know, and I've got a bit more ammunition to say, you know, you don't need the antibiotics. And that conversation is a little bit easier. Yeah, it has definitely changed my practice. I feel that, you know, I'm a mum of 3, so I do feel that adds as well more value.
Yeah.
But the course has definitely changed that. It's made me a lot more confident with conversing with secondary care colleagues and things. So.
I was going to say the quality of those referrals will be appreciated for
yeah,
sure.
I hope so.
And, you know, in terms of completing the program, did you ever feel, you know, stress with the program? Did you ever feel that it was, you know, that you'd taken on too much, or were you happy with the kind of the pace and duration of it?
One thing for sure, being a GP, a family doctor in the UK in the winter months is a nightmare anyways, you know. I think I was more stressed with my own kind of job, and because I work on call on a Monday and it's absolutely crazy busy. So my stress was more from my work. I felt that this was actually quite a nice break from that, you know, sitting down and learning some material. I didn't feel like it was stressful because, like you said, I mean, I wish we could, hopefully the people will attend the webinar to learn more, and they probably might show the dashboard as well on the webinar. It's very, very engaging, it's fun. It makes you, you know, you're learning lots of important information, but you don't feel like you're learning, if you see what I mean. It's very engaging. I thought it was actually a break for me to be learning and getting back into that, to be honest.
It was amazing, actually, the amount of people on programs during COVID, and not just this program that would say to us exactly that. You know, this was a couple of hours a week where I just took a release from all of the other chaos, and, you know, I'm with a group of 20 odd people that are all in the exact same position, and, you know, that sense of camaraderie is really important. And that, you know, there's hidden benefits to programs like this, and some of it is exactly that, you know, you get this bond and you get this group dynamic that can be really quite powerful and nice. And I think going back to the conversation we were having on you know, the amount of study you did and the rhythm of that study, I think having it established with your colleagues, with your family or your flatmates, whatever it is, that, you know what, on a Wednesday evening, I'm going to go into that room and I'm going to stay there for an hour and a half, and I'm going to be doing my pediatrics program. You know, it's quite nice sometimes to have that separation.
Yeah.
And, you know, equally then it's important that it doesn't bleed into all of the other parts of your life, that, you know, you can pigeonhole it and say, you know what, on a Saturday morning for an hour or two and on a Wednesday evening for an hour or two, I'm going to be doing my pediatrics program. And outside of that, I won't be. You know, I think that ability to balance it is really important. The other, I suppose, the other piece that I was going to touch on kind of in summing up is, you know, when you were considering joining the program, what advice do you think would have helped you? What advice would you give to someone else that's thinking about it?
For me, because Ashton gave me so much information, I felt like I went in there knowing exactly. It is long. You know, 6 months seems like a long time. The fact is, it's going to go quickly. Yeah. And actually, the other piece of advice is it's not as difficult as people feel that it might be. I did feel nervous when I started the course because I thought, oh, I'm not going to be able to manage. But actually, it does fit, you can fit it around your work life as well. So that would be my advice to myself, that don't worry, you're doing the right thing. It's, you know, you're going to manage it. That's one thing. The other thing is maybe, I don't know, I'm just trying to think of anything that might help someone else.
Sure.
That may just to keep engaging with the dashboard every week and try and finish the dashboard before you have the tutorial.
Yeah.
So that, you know, because sometimes the material might be happening on the tutorial that you might not be familiar with. If you do the dashboard first, then it reinforces some of that knowledge that you will have got from the dashboard learning. So that's one of the things. So some weeks I didn't do that, and that made me feel like, oh, this is a new thing, you know, and it can be a little bit more stressful then.
No, I agree. I think you'll always get more out of the tutorial if you've done that, you know, and it is probably only an hour of going through the content, because then what you're looking at then is application. You know, you're not looking for the tutor to explain it to you. You're looking to say, right, you know, let's get into the interesting case studies. Let's see how this manifests in real life, you know, and that becomes far more of an interesting two-way conversation. If the tutor is kind of going through the basics of, right, here's what rehydration is, that's not of as much value as to say, right, let's take this example. What's the right thing to do here? How would you spot this? You know, so I think that's great advice. You know, a really small amount of preparation can just enhance that experience massively. The other thing that I think you've done particularly well is carving out the time, and carving it out in a way that, you know, you were able to fit it around your family, fit it around your work, you know, that, and not everyone's going to have the luxury of being able to do that. You know, some people will end up doing a half an hour here, 20 minutes there, an hour there, and actually some people choose that as a learning style, and that's, you know, that's perfectly fine. But I think whatever, intentionality is probably key, that, you know, you're deliberate about saying, well, actually I'm going to do half an hour a day, and if, you know, if that's on a tube or on a bus or not in a car, hopefully, you know, that's perfectly fine. I think to your point, it's just a really small amount of planning. It goes really, really smoothly, and I think that's the bit that I think people should kind of think about, is it's very, very achievable once you just say, okay, you know what, it's going to be a Wednesday evening or a Saturday morning, and you're comfortable that you can kind of make that time. Now, if people have on call and shift patterns and whatever, you know, not everyone's going to have that luxury, but being able to say then, well, look, I'm going to make an hour every second day or 20 minutes a day, whatever it is, that means that they keep on top of it. And I think you're absolutely right in acknowledging that you will slip, you will miss things, you will fall behind on a couple of occasions, but there's enough scope in it to make that
exactly.
back.
Yeah, because I mean, 6 to 9 months, it seems like a, you know, a long, it's kind of, it's marathon, not a sprint, is what I would say, you know, slowly building up your stamina to get to the point where you finish the program. But it got to the point where my daughter, every Wednesday, she'd say, Mummy, it's your tutorial, you know, come on, it's tutorial time. So it was quite nice because I was involved in them, and it became part of the routine. When it stopped, I actually felt a bit of absence, you know, withdrawal symptoms, you know, oh, no tutorial now, you know, but yeah.
No, and that's, you know, again, that's quite common, that, you know, you get, there's not too many other scenarios where you get to converse and debate and discuss something that you're interested in with another 20 odd people. You know, that structure is a really important part of why we do this. And people, you know, when we get feedback on the program, the quality of the online platform and the benefit of the tutorials are the two most highly ranked pieces. And, you know, that it stands to reason, but we're also very proud of that, you know, the experience should be a really positive one. And, you know, missing your tutorial, that's about the best result you can get after a program.
But yeah, it's been a good experience. I can't wait to get my certificate. I finished in January.
Yeah,
so I'm looking forward to that.
I was going to say they should be out. The Board of Examiners has ratified everything now, which means the certificates will be winging their way shortly. And you know what? There is nothing like it. And the RCPI, you know, being 3 centuries old, the certificate is that, you know, piece of parchment with the wax seal on. It's like it really looks the part. It's brilliant.
And then we've got a question here actually.
Oh yeah.
It says, thank you for this really insightful webinar overview of the course and its content. Would there ever be any consideration including physician associates? I mean, a lot of my, I work with 3 physician associates, and they all were like, look, because one of them was revising with me one evening. We were just sat here in the office, and she was like, wow, this is such good information. And a lot of people have thought about it. I mean, is there any scope to expand it to other health professionals?
Yeah, it's actually a very live discussion, because the program, you know, the program was set up specifically for doctors, and it's been wildly successful, probably beyond any intention that ourselves or RCPI have. The debate we're having now is actually, and it's really a question of, do you mix it or not? You can take a really coherent approach by having a homogenous group which says, you know, everybody in this course has a medical degree. At the same time, I think the conversation we're having is, you know, is there an option to have physician associates, nurses, you know, there are far more professions than just doctors that are dealing with pediatric patients and children. And, you know, and similarly, you know, the view of they're not little adults is as relevant to those specialities as it is to doctors. So it's, short answer, it's a very live conversation that we're having with RCPI at the moment. So yeah, we will be making that, I suppose, decision within months, I would hope. So yeah,
that'd be really interesting, because a lot of people in my practice deal with pediatric patients that, like physician associates or AMPs, and for them, you know, the knowledge that you get, like one of the things I just wanted to give feedback on, you know, was especially the oncology module. We don't think about cancer when it comes to children. If a child, you know, if an adult presents with symptoms of cancer, you know, cancer's at the top of our mind, we refer, we do all the basic checks. With children, like thinking that, oh, refractory constipation could be a sign of cancer, you know, that is a huge thing. And I actually did a presentation to the GP trainees here in the practice, because I wanted them to be aware about childhood cancers and what kind of signs and symptoms to look out for. And the material that you guys provided on the iheed, the dashboard for the Paediatrics Diploma, was a fantastic resource for it. So I feel that, you know, especially the cancer, especially the acute unwell child, the child safeguarding, the developmental milestones, all of those things. So yeah, there's lots of material, but yeah, it's all really good.
Yeah, no, I completely agree. And I think, you know, if you go back to kind of the broad objectives, you know, you want people to have that overview of child health, an overview of pediatric care. And then you really want to make sure that the red flags are going to be spotted. You know, that you've got people that are way more confident in making those decisions. And, you know, that if you get that benefit at the end of the program, it's fantastic. And that's, you know, when we look at the feedback surveys afterwards, confidence is probably the most common word that you see in it, that, you know, people are just way more confident than they were beforehand. And it stands to reason. You know, some people will have had a pediatric rotation in their undergrad, some won't. It's, you know, it's giving you that extra toolkit to draw from, so that, you know, in a given situation, you're more likely to land on the right management plan or the right diagnosis. And, you know, that's the single most important part of it.
Yeah. Well, thank you so much for taking your time out of your busy schedule. And yeah, I've enjoyed this conversation, and thank you for, you know, speaking to me today.
No, Zainab, absolutely. It's been a pleasure. And look, I hope the people that are watching and listening got some value out of it. The program runs 3 times a year. It's fantastically popular. You'll get information on it either on the RCPI website or on the iheed website. So, you know, pop along and take a look. And yeah, there's regular webinars about it, etc. But It's a program we're really proud of.
Yeah.
It has really good outcomes. So, no, always delighted to talk about it.
Oh, thank you.
Thanks so
Well,
much, Dana.
I'll end the live and we'll catch up soon.
Brilliant. Thank you so much.
Bye, Denise.
Cheers.
Bye.
Bye.